Tapos, please gather. Please gather. Sige, so for case 1, you have a 30-year-old male with severe status asthmatic. And then, you hook the patient to a mechanical ventilator. What will you do? What will you choose pala in a patient with acute respiratory failure from a severe status asthmatic? Sige, you-set mo na the ventilator. Siguro ang height ng gusto ko, ideal body weight niya ay 60. Okay, set the ventilator.
Lagay niyo yung palm ninyo sa flat surface. And then your now, ang pinaka-important natin na
So, ito yung volume. Sorry, and then, let's continue. Try to set the mechanical ventilator. 60 ang kanyang predicted body weight.
6 times. Confirm, Doc.
Anong difference
Pero kung medyo nadidistract kayo sa gitna, okay lang.
May additional lang din to na settings. But we,
So
for
this is the pure one?
But
yung,
this one, yes.
ito yun. Yung walang
Para for this
Sorry,
exercises.
Nakita ko lang.
So, anong weight niya, sir?
Predicted body weight is 60. Para hindi
60
na
times 6, 36. 360.
Tapos mag-triangle.
What
Okay.
was called you said?
The IE.
Okay, kasi
Uncomfortable kasi 1:4. So, 1:2.
kung sakaling walang IE ratio, ano po pwede natin?
Lock your
Kasi set nyo muna sige. You just set muna kung ano yung gusto nyo gawin sa patient.
Tapos,
We'll proceed with the discussion. Okay na kayo sa settings? Okay, ano pa? Ano pang isi-set nyo?
flat surface.
Okay, sige. Assuming 100 na yan. Sige.
okay, 100. Okay.
Forward block.
Control. Ayan. Pwede rin yan.
Okay.
So, ano pala yung reason nyo for choosing volume assist control over the other assist control? Dalawa lang naman. Ano ba advantage niya on this case? Asthma attack. Severe asthma attack. Probably, ito ay isang
Obstructive lang. Oh. Pwede naman
So,
naman.
ano advantage ng volume control?
The problem of the airway will be okay na.
So, may airway problem ka, pero
Reversible.
so you want to give
Volume.
volume. Ano ba?
Right amount of volume.
Okay. Tapos, syempre, pagod yung patient, in respiratory failure na siya. You want to, no advantage ng mga assist control, you
Let
rest
Rest
the patient. You rest the lungs para rest your oxygen demand. Now, ano naman yung disadvantage mo when you're giving volume for this case?
Pwedeng mag
You're giving
Trap.
volume, okay, gas trapping.
gas trapping.
Ano pa? You're giving volume, you're expecting changes in, especially in this case, ano? Pressure, di ba? Kasi obstructive lung disease siya. And alam mo na nag-asthma exacerbation. So, you risk having increased airway pressure and not in. How about naman pressure assist control? Why are you not choosing, or ano yung benefit naman, advantages na using pressure assist control on this type of patient?
Pressure assist. During the attack, dun siya beneficial. However, kapag na-reverse na yung
Ano yung may bibigay ng ng pressure assist
Usually, kasi
control?
nawawala kayo dun sir,
You have, you set the
pressure.
pressure. So you know the pressure you're giving. However, ang problem mo meron ka ng airway
Obstruction.
restriction, di ba? From the asthma attack. But like the volume AC, anong advantage ng pressure assist control? You also
Let the respiratory.
you also help the patient rest. Okay. So let's continue. Since yung patient mo set mo na siya sa pressure, volume AC, can you see the wave scalar na pressure?
talaga yung palm.
Yan mo na lang. Ano mo na? Yan mo.
Palm mo.
Yan.
Your palm. Regroup.
Look at your scalars of pressure. What do you notice?
Shark's
Airway
fin.
pressure
Okay. High airway pressure and
more than 36. More than 30.
Okay, kita rin yun dun, di ba? Your peak airway pressure is
More than
high.
30, yeah.
But are you concerned now? Ano ba yung gusto mo ring malaman? Aside from, kasi ito yung the
Lahat.
peak airway pressure is the airway pressure sa airways and also sa lungs. Pero paano malaman yung pressure sa lungs?
Flat, pilat.
Plateau pressure. But do you need to do a plateau pressure in this type of ventilator?
Pwede. Pwede.
Right now, do you need it? Kasi may
Meron ng value.
okay, kasi meron na side, di ba? So, ano yung how do you get the number ngayon? You see this you press. What will you press para mahabol mo siya? Yon, ang galing yung para. Ay,
Ano ba yun?
Kulang.
wala. Ito yan. So, okay.
Fine touch lang.
Okay. See,
Ano?
ano yung plateau pressure natin?
17.
17 and your peak airway pressure is
44.
sige. So, ano yung
Minus.
difference ng peak airway pressure and your plateau pressure? It's the
44 minus 17, 27.
or like most likely mataas siya. So it's the reflection of your
Pressure.
is it alveolar pressure?
Airway
resistance. So the
resistance.
difference between your peak airway pressure and your plateau pressure is your airway resistance. Pero kamusta yung ano mo, yung lung compliance mo or yung lung parenchyma mo? Okay ka ba or medyo malungkot ka? 17 ang plateau pressure mo. 17.
Yes.
So, happy ka doon kasi normal siya.
Less than 30.
In this type of patient with airway resistance, high airway resistance, are you afraid of this high difference? Kaagad, magpapanik ka na? Maganda yung lung compliance mo eh. Baka hindi muna, no? So, ano pwede mong gawin? Mataas yung airway resistance. Alam mo na yung pathology. May bronchoconstriction. Anong bibigay natin?
Mga bronchodilators.
Bronchodilators. Ano bibigay niyo?
Mga
Anong bronchodilator? Isa lang naman yung... Salbutamol.
Binigay na niya.
Nag-dip. Salbutamol. Nakas ng salbutamol na. So, what happened? What happened to your waveform and your airway pressure?
bumaba.
So, kaya mo po bang ano?
Paano nyo pinababa? Rinilis nyo lang, sir. Ang galing.
So, after this, nakuha niya, nag-respond siya. So, responsive siya dun sa bronchodilator. And gumanda na yung waveforms niya. So, pagka-hook ng ventilator, may lumabas. Ito na yung waveform after. Please go to this, wala po kami, hindi namin kaya i-replicate. So, what do you notice on the pressure scale?
Pataas yung...
Okay.
Pataas sa baseline.
Tama, no? So, during the exhalation part,
Breath stock. Gas stopping.
okay, there is bed stacking, gas trapping.
Iipon yung
The
excess
pressure does not go down to 0 or 5 and then nagtataas siya. So, anong hindi ko naman ito. Ano yung mga pwede nyo? And
Yan yung
sakto lumabas na rin yung blood gases niya para at least sabay-sabay na tayo mag
So what is this muna? This is a good example of
Sige. So, ano nang gagawin nyo? Or, aside from the gas trapping, and then meron kayong so meron kayong low pH coming from your so meron kayong respiratory acidosis and very good oxygenation. So what will you do? Sige, nagagas trapping ka na, nagagalit yung ventilator, tunog.
Disconnect the patient.
Okay, you disconnect the patient, you release the accumulated gas. Okay. And then, pagka-hook ulit, you may want to modify
For the
your
settings.
mechanical ventilator settings. So, how do you adjust your mechanical ventilator para ma-address yung gas trapping? In this patient, normally you decrease the R, but then, di ba, it's a backup rate. Even if you lower it down, if the patient is breathing above the backup rate, hindi naman siya meron. Okay. So, yung tidal volume, sana kasi pag ginilaw natin, bababa yung minute ventilation mo. Kaya lang gusto mo ngayon.
Yung oxygen, sir.
Eye ratio, sige. Let's go with eye ratio. How do you adjust your eye ratio on a patient with gas trapping and with CO2 retention?
Increase the expiration.
Okay, you want to extend or increase the time. Longer expiratory time. So, what will you adjust sa ventilator?
1:3.
Sige. Not all ventilators have this. May iba merong eye ratio modification. Sige. So, you adjust the eye ratio. Kung sakaling wala, ano pa yung mga pwede mong i-adjust? Sige.
Ibababaan mo yung
Inspiratory. So, a portion of your inspiratory time is the inspiratory pause. Sige.
Click mo lang.
Sige po. And then you decrease the
This is the percentage, right? In other ventilators, it's time. This one is in percentage, meaning it's a percentage of your entire
Total, oo.
So, babaan mo lang yung percentage.
in a way,
Makikita mo dito yung adjustment. Ang sagot sa gaano kababa will be kung ano yung mag-reflect na eye time.
so when you hasten or when you lessen the time of your inspiratory pause, you give enough time for your patient to have your expiratory time, longer expiratory time. Kung wala ka naman what else can you adjust? Okay. Wala dito, but we have yung peak flow. So, ang peak flow, if you increase it or decrease it, anong magiging effect sa eye ratio?
Peak flow.
Peak flow.
To increase the peak flow, the eye ratio,
Sige, pag tinaas ko yung peak flow, ano mangyayari?
Tataas din.
Ano yung effect niya sa inspiratory time? Nagdi-decrease. And kapag nag-decrease yung inspiratory time, mahaba din.
Mag-increase yung expiratory.
Oo. So, ang mangyayari dito, but since you're giving a volume, high volume, ano yung caveat, no? Meron ka, tataas yung pressure, di ba? So, so be aware that if you're giving volume, you're also monitoring the pressure. Okay. So, ayun, aside from that, so you adjusted the peak flow. Higher peak flow causes decrease in your inspiratory time and gives you enough expiratory time. You adjust a lower inspiratory pause, inspiratory time. And you also adjust your eye ratio. Okay? So, yun, in fact. Ganyan. I guess we're done.
Sir,
Let's go to
sir,
the second.
ito ba yung sinasabi mo na kaya niyang magsariling Hamilton, mag-win?
Yes, yung ASV. Pero it's a different
Okay.
yung adaptive support ventilation.
Okay, sir.
Your passive maganda, anesthesiologist po.
Yes, sir.
Mas maganda yung sa post-op patients. Pero should be a separate
Kasi brother,
session for this one. Kasi hindi siya kasama sa
Oo, sir.
common modes that we need to teach sa basic ICU.
okay?
It's basically an advanced mode.
Okay, going to our next case. We have enough time. Sige. You can read the case para everyone can hear it. You have a
72-year-old man presenting with acute pulmonary edema. Intubated, ABG prior to intubation, 15 liters per minute, on face mask, with pH of 7.1, PCO2 49, PO 26, and bicarbonate of 16, predicted body weight 70.
So, patient on acute pulmonary edema na nagka-respiratory failure, you intubate the patient, and you put the patient on face mask, and the reading is respiratory acidosis na may inadequate oxygenation. So, may hypoxemia siya dun sa ABG. So, in this type of patients, okay, what will you do para ma-address yun? Intubate. Sabi nung...
Iniwan namin. Intubate ko pero iniwan ko siya.
Iniwan ako.
Sabi ko nandiyan naman si Dr. Raguen.
Si Dr. Gwen. O, Dr. Gwen, set the ventilator ha, kasi ihi mo na ako. Ihi mo na, ihi ako after
Kasi yung problema
intubation.
naglalagay kayo ng pangalan. Hindi ba tinapon na nga yung mga pangalan? Hindi ko kaya, Doc eh. Marunong lang ako mag-intubate. ikaw na nani. Set the ventilator. Ito yung ABG mo.
Sabi ni Doc Kevin, bilisan daw na.
Eileen ba? Yung Eileen
Doc
Lim.
ulit. Doc Eileen. Doc Eileen, si Gwen na po yung mag-a-adjust
Sa mode ka. O, anong mode mo, Gwen?
Kasi po nag-basic ICU na siya, kayang-kaya na po yung
Hindi, nakapos ka. Sige. Yan, masyadong dyan.
Sorry.
So ito, ano kaya ang problema ng patient?
So, very, siguro, congested siguro. Pangit siguro ng lungs ngayon.
Ano kayang pipiliin ng mode? Dok, may pinabigay namin kay Gwen yung patient. Siya na daw mag-set ng ventilator. Si Eileen Lim yun. Sige, sabihin mo. Sige, Doc, update kita. Anong sinet mo?
Ay, mas gusto ko yung ganito.
Okay, don't push this one. Yeah. Yung yan, yung modes.
I get. Alam ko na kung bakit. Sige. Ito ba yung pinili mo yun? Si adjust.
Yun yung pinili mo? Doc, pinili po niya.
Volume daw, Doc.
Ay, Doc na. Volume pinili mo.
Pressure.
Ambis.
Pressure daw.
Diba? Sabi niya, sige nga, anong sinat niya? Anong sinat niya? 360.
Pressure control.
Gusto pala, mahilig pala sa pressure AC si Doc Ay.
Hindi.
Kasi
Tapos prediction.
Doc, sinat na yun sa PCB. Okay.
sige.
How do you decide which one to put, what to put here?
Wala ka lang.
Pressure na yan. Sige Doc, detail lang kami yung setting Doc, sabi ng RA. Nabag mo namin Doc.
Doc, ang tagal, Doc. Bumalik siya. Doc, nag-ano ulit. Volume ulit, Doc.
Bakit po?
I-clear mo muna. So, you want to measure and confirm. Tapos confirm mo yan. Yan na ba yung gusto mo?
Sige. Okay. Sige.
Pressure control.
Okay, sige. You set the patient on pressure control with the inspiratory pressure of 15 and a PEEP of 5. Yung oxygen, hindi nyo nagagalawan. Kung sakali tataas nyo, anong gusto nyo level?
100.
For this purpose, kunwari 100.
Wala tayong oxygen mag-alarm. 21%. Oh, bakit ka umalis na? Doc, umalis na siya. Kakaset ka ng ventilator. What do you do after setting the ventilator? You have to do
Yun lang ba? Yun talang
MS.
titignan. Ito lang may titignan mo after.
Patient.
Hey, you check the patient.
MSCV.
Sige, Gwen. Diyan ka lang, Gwen, ha? Diyan ka lang. Sabihin siya.
Okay, sige. So, since in-adjust yung ventilator sa settings na yan, ano nga pala yung sakit ng patient nyo? Meron tayong
Pulmonary edema.
pulmonary edema. So, may hypoxemia siya kasi flooded yung kanyang alveoli. Ano pa yung mga mechanical ventilator maneuvers to somehow aid your patients with pulmonary edema? Flooded yung
PEEP.
alveoli. You want to?
Increase the PEEP.
Increase the? Sige. PEEP daw, sige. Okay lang ba yung 5? Gusto niyo ba pagtaasan? Doc, ay, ginala ulit to.
Update natin si Doc Ay.
Sige.
Doc, nagtaas pa lang.
Sige. Very good daw, nagtaas ng P. So, in a pressure control, since you control the pressure, so you expect na tataas yung yung bone airway pressure. Then also you monitor the, so you're giving a set pressure, your variable is the tidal volume, okay? So since wala naman tayong plateau pressure dito, ito na yung buong pressure, ito na yun. So you add this and you see the changes here. Okay? Any pressure above that, baka sa lungs nyo na yun. Okay? So ano ba yung effect ng high intrathoracic pressure to patients or with in a normal heart? What is the effect of a high or transpulmonary pressure.
Decrease cardiac output.
Decrease cardiac output kasi meron ka decreased preload, iniipit mo eh. So, high transpulmonary pressure, nag-refresh sa heart, iipitin yung mga vessels, LV, RV, so low cardiac output sa right. Pagdating sa left, high intrathoracic pressure will also decrease your preload. Afterload probably not. Increase, so ang gagawin, so decrease preload and probably decrease your cardiac output in full. But since it's a normal heart, hindi mo ma-notice yung changes. But in this case, how can your positive pressure help your patient's condition, knowing na meron siyang probably left ventricular dysfunction kasi nag-pulmonary edema siya? How can your positive pressure aid you in probably helping yung kanyang edema?
Decrease further pulmonary edema to decrease preload.
Oh, lalong walang cardiac output, dinipis mo yung preload.
Increase.
So, una, yung PEEP, anong effect ng PEEP doon sa ano?
It opens the sick.
You give enough surface area for adequate oxygenation and ventilation. Pero sa heart, anong gagawin ng mataas na transpulmonary pressure? So, magbibigay siya ng konting pressure, matatranslate sa heart. What you call that pressure? Transmural pressure. Ano ba yung problem ng left ventricular heart? Left ventricle ka nagko-congest kasi may aside from the ano yung kalaban niya.
Mga
mataas
valves.
yung kailangan niya gawing afterload kasi mahina na siya. So what happens when you have high transpulmonary pressure, you somehow help your weak heart, your left, to pump out the blood. So in a way, it lessens your afterload. If you have lesser afterload, you will help the patient increase yung cardiac output. That's why yung mga NIVs and also patients on ventilator na you put in, you help the left heart.
So basically, generally, ang effect ng positive pressure ventilation would be decreased preload, afterload, and variable cardiac output, depending on the physiology of the LV or left ventricle. Kung tatanungin kayo, generally, variable dapat yung sagot na cardiac output. Dok, hindi ka na nagbigay ng diurnal, sabi ko.
Pwede naman. Pwede naman po tayo magbigay ng
Parang
diurnal.
siya ng unloading.
Cardio po ba
Tayo ng
sila?
cardio.
Gusto rin ng pull mo yung use.
In-intubate mo, iniwan mo lang. Tapos binigay mo kay Gwen, hindi tayo nag-unload.
Then naka-order. Order yung Furo Drip.
Anak, tok, hindi ka nag-ano? Hindi mo na kinagay
So if you have any questions po, if you have enough time, hopefully we can answer your questions. Ayun, so...
Paano mo malalaman yung isa-set mo na pressure?
Okay, good question. Sige. Di ba when you set pressure sa pressure control, you control your pressure.
Ay, pressure control. Sorry, pressure.
So you control your pressure kasi ang variable is yung
The volume.
So syempre lang protective ventilation ka pa din. So you want when you add these two, you will get somehow normal values. Diba? Less than 30 pa rin naman. Kasi wala ka na. Okay. So careful ka.
5 ka. Anong pressure mo? Isasagad mo yung...
Isasagot mo to 22 pa lang naman. O peep of 8. Para you have a peep of 8, pwede mo pang adjust yung pressure ko.
Isasagad mo siya up to 30. So
Pwede mo i-adjust. Sige.
Dagdagan mo pa mga
See? So, ayan. Gusto mo ng ayan.
22.
Sagot natin.
30 ka.
See? So, kaya yung maganda sa pressure ko to, hawak mo yung pressure ng patient. But, ang trade-off yung
Unit ventilation.
tidal volume unit ventilation. Kaya may siyang bantayan.
Like for your patient, diba, pangit yung compliance, anong i-expect mo na tidal volume? Yun yung trade-off sa high pressure.
Kasi hindi kami nag-furosim.
Mas tataas.
Mababa yung tidal.
Bababa yung tidal volume, and then your patient will become more. Anong magiging blood gas?
Hypoxemic.
Hindi mo makapag ano,
volume. Before siya
ventilate eh.
Before maapektuhan yung mean alveolar pressure kasi is mag-ano mo na yung patient. Hypercapnia. So acidotic mo na siya kasi low volume. Yun yung trade-off ha. Kaya namin in-emphasize dito sa station na to yung nagagalit yung consultant kasi gusto niya pressure control. It's not wrong to do it on volume control. No? Whatever mode you're comfortable with, for as long as you know yung mga trade-offs, ano yung mga complications.
Dito
Like
ba
when you
sir
choose,
sa...
yeah.
Dito sir sa pressure control, since may binigay na predicted body weight, yung computation ba ng predicted body weight is
Yun rin yung
6 pa rin dapat dito.
Parang inisip
Yun ang
mo na
dapat
lang
target
natin.
namin
Oo.
siya. Okay.
Kaya nga maganda tong mode na to. This one. Because it takes care of your volume.
Kumbaga sir, hindi siya lalagpas dyan.
Example. Tapos maglalagay ka ng alarm limit
Pressure.
na pressure. Kumari 40 yung alarm limit mo. And then, nakikita mo yung blue line ngayon. What's going on? Anong ginawa ko?
I-ano mo lang. Aksan mo lang.
Ayun. You can see the blue line there. Your pressure will not go up. So, hindi mo na problema yung trade-off issues. Yung variables na sinasabi niya.
Anong mode to sir?
PRVC yan.
PRBC.
Sa inyo, sa Mindray, that's PRVC. Here, it's CMV+. So, the blue line here is the limit of the pressure every breath. But, kailangan niyang ibigay yung 350. So, every breath, magkaiba sila. Iba yung pressure. May varied din
Pressure
pressure.
release volume control.
For as long as mabibigay niya yung volume na 350. The physiology you see, this is still decelerative pattern of flow. So this is still a pressure control physiology. But with a reset na volume. Kaya pinalitan niya, kaya may plus, CMB pa rin siya. Pero plus. Pero yung physiology niya, mas pressure kaysa volume. Misnomer yung volume control.
Anong difference dun sa APR?
APRV is a different, pang ano yun, pang recruitment maneuver. So, may APRV ba dito?
Hindi yan. Meron ba tayo? Okay.
Sa APRV recruitment maneuver siya kasi allow the patients to breathe at a high pressure and then you release for a very short period of time. So, let's say 40 inhale, exhale, tapos mag-release siya para hindi pumutok yung alveoli. So, basically, that's for recruitment maneuver. A very advanced one. I'm not comfortable with it, I've tried it, pero that's a different type of mode. Medyo advanced na. For mga ARDS yan, nagising.
Parang kahapon may nag-ask din. Sa akin yung EPR.
Gising na pasyente. Kasi sa Europe, gamit nila yan for awake patients on ECMO, BAM. APRD gamit nila. Kasi continuously na gusto mag-recruit ng klase ng mga BA. Kaya sumigat na. Everybody's asking about that. Pero mahirap siya. You have to be at the bedside the entire time. Mahirap siya. During the first few hours, labihan mo yung patient. Kasi imagine na, you're allowing the patient to breathe at, let's say, peak of 25 or something like that. And then i-release mo lang siya, 1 second. Magsiset ka, let's say 5 seconds na peak high, and then 1 second na peak low, or 0.5 second peak low. Yung meaning nun would be lengthening of that time, and then lowering of the peak high. So, kung bumaba na yung ibig sabihin, nare-recruit pa na naman.
Pero
Prone ka na lang.
mahirap kasi siyang bantayan din. Kasi babantayan mo siya. Mahingayin mo kasi siya na on high pressure.
Very high
tapos
pressure. Very uncomfortable. Tsaka ayaw mo na sobrang sedated kasi yung trade-off rin nun is respiratory acidosis. Meron kang
inverse eye.
you allow hypercapnia for that condition. Kasi maliliit yung breaths niya sa taas ng pressures.
Ay, maraming salamat.
Ay, sorry. Idol po. Mas ano ba na dapat ibaba yung
Babaan
pressure
na.
kesa sa peak?
No, wag mo munang babayin yung peak kung nag-oxygen, kung oxygenation yung issue mo. Kung yung volume yung naging feeling mo mataas, ang papalitan mo muna ito. Kasi yung peak mo here is for oxygenation purposes, kaya tinaas ka siya. If you bring this down, pwedeng magdesaturate. But if your concern is yung volume tumataas, yung pressure yung babaan. Pressure support or the pressure above.
Thank you
Thank
very
you.
much po. Thank you. Thank you.